Welcome to Neuro Stories, the podcast that highlights the people behind neuroscience at the Walton Centre. Together, we will lift the lid on the complex worlds of neurology and neurosurgery and everything in between, hearing fascinating tales of the incredible staff and services carried out in the hospital every day.
I'm just going to send this and I'm ready. My name's Jon. I'm the Advanced Nurse Practitioner in the Neuropsychiatry team here at the Walton Centre. And I've been here 5 years almost.
So what kind of areas do you cover then?
So our team cover both inpatients and outpatients, and our referrals would come from neurology, neurosurgery, neuro-rehab colleagues who would get in touch with us when there's a patient who maybe has a past medical history, which is symptoms of mental illness. They may have new symptoms and need some support. Yeah. And we come along and assess patients, would monitor them and then treat them throughout either their inpatient stay or in the community in our outpatient clinic.
So all areas really of the hospital will refer patients to you?
We have 6 outpatient clinics a week, which is around about 25 to 30 clinic appointment slots a week.
Crikey.
Yeah, and then our inpatient caseload, we obviously cover all the inpatient wards across the Walton Centre and Cheshire and Merseyside Rehab Network. So
that's busy.
Yeah, we're
it's a
on
busy
and off
team.
site a bit, yeah.
Because I don't think a lot of people really realise that not only is it based here on site, but in the community as well. You will go out across the region and see patients.
Yeah, so we go to St Helens Hospital and Broad Green Hospital, and hopefully that may grow even further.
So what got you into this, Jon? How did you start off, heading towards nursing and the specialist nursing that you do?
Oddly enough, I always wanted to be a paramedic, and I went to college to do health and social care, and then eventually applied for university, and just a purely last minute decision made me decide that I was going to pick mental health nursing. So it was one of my more impulsive decisions in life, but I'm glad I did it now.
Was there a specific thing that you saw that meant, I want to go there?
I'd done a placement in a drug and alcohol rehab setting while I was in college, and I thought, this was interesting. This was different to, the other placements that I'd had. And they all explained that they were mental health nurses by background. So without knowing much more than that, I just jumped straight in. Went for it, yeah.
What was learning about that area like?
It was interesting. I think that time I've never been like a big lover of all the academic side of things. I'm much more sort of practical.
Get stuck in.
Yeah, people person. But I did learn a lot. I didn't particularly have anybody in the family. Sometimes people tend to say they've got like close links or, family who've suffered with their mental health and lots of experience that they kind of use towards coming to that decision with their career, and I didn't really have any of that. So I learned an awful lot over the years, but I wouldn't change it now.
And what's it like applying all of that to the Walton Centre setting?
So it's changed a lot since the time I started 5 years ago. The service was very small at the time, and we've grown quite considerably in that time, I suppose. So I hope that we've been able to improve things even more. I think lots of things that the team can offer being of benefit to patients and staff really over the years, just in the sense that we may come along with suggestions regarding environmental factors, not just necessarily medication or focusing solely on risk. We might take a number of different things into account that we've picked up in our experience from mental health settings or A&E, and then just using some of that stuff and applying it here does feel like it's worked relatively well. And the patient group, probably my favourite that I've ever worked with, which is why I've stayed here.
Why do you say that? Why are they a particularly good patient group to work with?
Patients at the Walton Centre tend to have gone through a lot, to lead them to need more care and treatment. And I've found that whilst we can have really challenging days, I think you have more rewarding days. And I find that I come away thinking, no matter how difficult the day was, the patients that we've seen needed our help. I think that it does feel more rewarding in lots of ways.
With a lot of brain injured patients, say, for example, that group of patients, there can be, like you said, not only that physical progression where they can rehabilitate as far as they can go, but then there's also the mental health, the psychology can improve
Yeah,
too.
absolutely. And I think we've been able to be part of the patient's care and hopefully improve things faster, which is one of the key focuses that we have, I suppose, is our team in neuropsychiatry, colleagues in neuropsychology, actually adding that to the picture with physio and occupational therapy and all the other disciplines that are around. We hope now means that patients will be recovering quicker and are getting the best opportunity to recover quicker, really. And I think that's shown in, the time from injury to discharge, even if it's discharge to, a rehabilitation setting, has reduced significantly over the years. So I think that reassures us that we're doing the right thing.
The balance between that physical care and also that mental support.
Yeah, it's definitely, I think we wanted to run our service and our service function on the basis that everyone's physical health and mental health should be treated in equal priority. And just because I guess that, we have patients who may be in hospital and unwell but physically, they still have a right to access support for their mental health. It sounds, really common sense, doesn't it? But I guess if your mental health is in a good place, you are in a better position to engage in physical rehab. And that's one of our aims, to make sure that people are at the sort of optimum ability to engage and to to get better and eventually leave hospital.
And do you find that that's what's the most rewarding part of your job, seeing those patients get better and feel better?
Yeah, definitely. I think we're very lucky in neuropsychiatry that we can follow a patient's journey right from critical care, so from being in intensive care here on Horsley to acute neurosurgical wards, rehabilitation, and then potentially still engage with the patients as outpatients after they're discharged. So I think we can see drastic improvements, really, and that might be over periods of time. It's always nice to have someone come back who, I might have gone to a ward and seen whilst they've been really unwell in intensive care, and months, years down the line, to actually have them in the outpatient clinic. They'll thank us for kind of being involved and helping them, and so that's the nicest bit.
It's the long game with a lot of these patients, isn't it? Yeah. There's no quick fix to get back to as close to normal as possible.
Yeah. I tend to find that we have to try a lot of different things and we don't always know what's going to work. So if that's environmental changes, if that's medication, if that's, how we support a patient and how we adapt and make adjustments ourselves, it's a bit of trial and error.
But that's where your experience kicks in, isn't it? You see similar cases and that knowledge base that you've got, even knowing what to try is the value, isn't it?
Yeah, absolutely. And I think that has definitely been something that I've looked back on over the years and thought, I think staff have moved almost on that journey with us, really, which has been nice. We want staff and patients to be safe, don't we? So we may do things slightly differently. And I think we can bring another perspective, which actually it's improving everyone's knowledge around us, isn't it? We still tend to have the days where we'll go to a ward to see a patient who can be really distressed and agitated, and they're always calm when we turn up, and I think sometimes the staff don't think that we believe them. But no, it's good to have them good relationships, because I always describe to them, they're like our eyes and ears. So we go to a ward to see a patient, we might be there any length of time, from 20 minutes, an hour, 2 hours, but actually there's another 20 odd hours in the day.
Absolutely.
And they're the people who first pick up that someone's, distressed when their visitors leave, for example, or when their medication might be late, or for any number of reasons. So they really are the eyes and ears. I think the fact that we're all kind of wanting to achieve the same thing,
heading in the same direction.
Yeah, absolutely.
What would you say are the challenges in your role?
Primarily, some of the challenges can be trying techniques which we hope may work, but differ from person to person. So I think that there's an element of that trial and error, whereby something works really well for one patient and not for another. And staff, we almost have to keep staff on that journey of knowing that, we're just because we've tried one thing and it maybe hasn't worked, it's not a failure.
It's not the end.
No,
Yeah.
we can try something else, and we've always got new ideas to bring. The other challenges would be day to day, I guess, busyness, things crop up, and you want to spend as much time as possible with patients. And I'm in a job where I'm kind of 50% managerial and 50% clinical. The dream would be, I suppose, to be even more clinical, I guess.
Yeah.
That's, I guess, a challenge for just making sure that there's enough of us in, and that we can see people in a priority sort of based order, and make sure that people get seen and staff are aware of plans and communicate them plans. And because staff on shift change constantly, staff move wards, then I guess just kind of reinforcing that and keeping up that work is what we hope improves over time.
Absolutely.
And it clearly has done. Okay,
Jon, are you ready for the quick fire round?
Bring it on, I'm ready.
What would you be if you weren't a specialist nurse?
I've got 2 answers for that.
Go on.
I suppose first one would be, as a child, I always wanted to be an ice cream man, which I think still I could be tempted.
Surrounded by ice cream.
Drive around, eat an ice cream. Yeah, and it just feels like a positive, happy job. I'm sure it's probably not in the winter, but me child brain wasn't thinking of that. Other than that, I think I'd still like to work with people. Not quite sure what else I'd be good at.
I think we should go with ice cream man.
Yeah?
What's your biggest hobby?
So I've got 2 dogs that probably everyone knows that I'm obsessed with. So I've got 2 pugs, just walking them, spoiling them, letting them kind of take over my life seems to be one of my biggest hobbies.
Favourite song?
Lost Without You by Freya Ridings. Sad one. Love it.
Favourite book?
I like anything by Matt Haig because it's always mental health focused, mindfulness focused. Love his work.
Favourite film?
First thing that came was the Titanic. I mean, it's just...
It's iconic.
Yeah. You know, when you watch it back though as an adult, you can clearly see the production probably would be better in these days. It was good, and if I watch it now, I'm like, you're on the edge of your seat.
It's epic. Favourite animal? I think I know the answer to this.
It's going to be a dog, always. Always had staffs, and now I've got 2 pugs, so it's got to be a dog.
Dead or alive, who would you most want to have a drink with or take to dinner?
I'd say Peter Kay. He's alive.
Oh, right.
He's funny. I think that you'd just laugh all night. Would love it.
What food do you love?
Thai food's probably number 1.
Food you hate?
Oh, I hope it doesn't obsess anyone. Turkish food.
Right.
Yeah, it's just not for me.
Best thing to happen to you?
I guess I have 2 nephews. Be fortunate enough to have travelled a lot. Stayed in Thailand about 6 months.
Oh, wow.
On and off.
That's incredible. Something very few people know about you.
I was once on holiday. They were taking photographs of the hotel for the brochure, and they said if you get in the swimming pool, you get a free drink. The back of my head was in the brochure the next year of me just in the swimming pool, and I got a free drink. Why would you not do that?
Looking back over your career here and also, before the Walton Centre, how has neuropsychiatry changed over your career?
I think when I first qualified as a mental health nurse, mental health services almost feels had maybe slightly more wiggle room and finance. And I think probably like all services that maybe has reduced over the years. So that's become a challenge that I think we need to get more out of our staff and our services and even our estates than we've ever needed before with less money. So I think there's been a huge change in kind of trying to still be innovative and deliver good care. For us, I guess in psychiatry and neuropsychiatry, things that have been the bigger changes in my sort of 14 years as a nurse would be the move really into community-based support, outpatient services, and now what we've felt over the last sort of 3-4 years is the move towards telehealth, electronic video calling, and at first I think it's normal that you don't like it that much.
It's a change, isn't it?
Yeah. As I say, I'm a people person. I like the person to be sat in front of me in the room. I think you can learn a lot from just that kind of body language and the sort of demeanour of a person. But in saying that, I have found that over the last probably 2 or 3 years, it has got easier. I guess we're lucky if you tend to get to know your patients. Even on a video call, you actually can see if there's been an improvement or a deterioration. It's just a different skill.
It sounds like you've honed that skill of being more observant, maybe on a video call or on a telephone call to a patient, to go, hang on a minute, you sound different, or you're carrying yourself differently. What is there something that you want to discuss, sort of thing?
Yeah.
So I suppose it's a different challenge, and obviously one that's been born from the pandemic.
Yeah, absolutely. And I think in the first 12 months, I'd be happy to say, oh, I hated it. If I could get any patients in face to face, I would do it. Started to think about our patients who were in the Isle of Man, in Wales, and actually was, a 30-minute appointment with me to say, actually, things are going all right. Got really kind of stressed in it that actually you think there's a good argument to do both, and that's what we do. Well, we do a mixture of kind of telephone, face-to-face and video. If a patient's called up and said they want to speak to me or get a message passed over, she'll always have a chat with me and then just book it in my diary, even if it's just that ad hoc phone call, because you tend to know the patients and we may have seen them before. It's so much easier to just have a quick catch up and say, what do we need to do? What can we do to help, really? So that's been something that I think your confidence grows with over time.
Where is it headed?
I would hope that neuropsychiatry is headed towards expanding those services in places such as the other areas of the rehab network and the wider sort of system. And then eventually I'd hope that we head towards community services, really. So we do have our outpatient service at the moment, but actually if we could head towards community-based services, treatment, and actually being able to see patients at home or in places that's closer to them, that would be my hope. We do cover just such a geographical patch that it's always a challenge, but I think that would be my hope for the future. And then to continue to kind of work with our colleagues in neurology and neurosurgery to kind of innovate what we can do. And it's something that we'll definitely be working on as
that's
time
the direction
goes. Yeah, absolutely.
Yeah. Finally, for this bit, what are you excited about, with the future of psychiatry, neuropsychiatry?
I think the first thing that's sprung to mind then was we've recently just developed our patient feedback, and that's like probably the most important thing to me at the minute. And generally, I want our patient, family, carer and friends feedback to be more accessible. I'm sure lots of people might think that's very sad, but for me, seeing that people can access our feedback and so we can develop our service to what it needs to be for people has been the thing that's exciting. And since we implemented the QR code as opposed to just the old-fashioned paper copy, it opens it up to more people, and it's just exciting when people complete it now, and we can look at that and see what we could do differently, or take them suggestions on. And that's nice to know then that we're on the right track, and patients and families are kind of having benefit. I think that we learn so many skills here from our colleagues across all of our services that it does give you ideas to think, okay, is there a possibility in future that we may be able to develop a sort of assessment tool that focuses primarily on mental and emotional well-being, or is supported by maybe our speech and language colleagues specifically, and really focusing what we do for our patients and those who we do it for. So that would be kind of some of my focuses. Always lots of research out there that we like to keep up to date with, just to make sure that we are just constantly improving patients' experience, really, and treatment. And I think some of that working together over the years would be something that I'd be excited about, maybe getting more neuropsychiatry colleagues from across the country together to, share and learn from each other.
Thank you for listening to Neuro Stories. You can listen to more episodes on Spotify and stay up to date with the latest news and events from the hospital on our social media channels at the Walton Centre on Facebook and Instagram and at Walton Centre on X. Got feedback? Email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.